little bit later on, I'm going to be talking about an energy company that decided to send its staff on a big jolly up to the Maldives. And people are saying, oh, that's absolutely terrible, isn't it? We're all struggling. Yeah, OK, I do get that. But at the same time, I mean, if a company's making money, why not send your staff to the Maldives? I think that's quite a nice thing. But anyway, a bit closer to home, the NHS has decided to send some of its staff to India, but supposedly not for a holiday, to help drum up a little bit of, well, recruitment for doctors and nurses in our UK health and social care sector. Now, it comes amidst a staffing crisis in the NHS. In October, a leading social care charity reported, I should say, the highest rate of vacancies in the sector. We have 165,000 unfilled posts. It is fascinating when you compare that number to the number of people who, of course, decided that they were going to walk out of there because they couldn't keep their jobs if they didn't, do what we were all told to do during the pandemic. But there we go. Accident and emergency waiting times aren't showing any signs of improvement either. New reports suggest that more than half of patients waited more than 4 hours to be seen. So that's in your A&E. And with some waiting 10 hours or more. In fact, I've just clicked onto an article here, I did that in the break, which shows that around 18 months, so NHS strikes force thousands to wait 18 months for surgery. So that is supposedly, and this is, by the way, in The Independent, which is, quite left-leaning. They're saying NHS strikes are forcing. Nothing else, they're saying the strike. So there we go. And, of course, there's no quick stitch-up job in sight. Let's speak now to the Independent, not the Independents, just an independent statistician and former head of health analysis at the ONS. It's Jamie Jenkins. Jamie, thank you very much. Great to have you on the show. First and foremost, I mean, the waiting times and the length of time people are having to wait both in A&E and for routine surgery, I mean, let's be honest with you, it is being made catastrophically worse by this strike action, isn't it?
No, Patrick, it is being made worse by the strike action. You can't divorce the fact that, if you look at some of the ambulance response times, they hit some record levels in December. That's at a time when the ambulance workers were on strike. And you look at the data that is published every single month. There's a target to get about 95% of patients. So if you go into A&E, about 95% of the patients to be seen within 4 hours. And you've got some trusts across the country where, you've got over 50% of patients are not being seen within the 4 hours. So they're way, way off these targets. You have got a postcode lottery across the country. Some areas performing much better than others. But it's pretty bad out there at the moment, Patrick. And we do know, because they think, OK, well, take a little bit longer to see somebody. What's the problem with that? What we do know is, many research has been done over the years that shows that when you get those delays in seeing somebody, when you go to the hospital, those 4 hours could be the difference then between life and death for some people, because we do see an elevated risk of death when you have these delays in the system. The strikes won't be helping, and obviously all these vacancies. I think you just talked about going to India to try and recruit people.
Yeah.
The vacancies won't be, they won't be helping the matter as well.
No, indeed. And when I look at the care sector, just in isolation, so not people just working as frontline A&E doctors or nurses or whatever. So people in the care sector, quite often they are paid less than your average nurse or certainly your average doctor. They, I note, are not out on strike. But we do have vacancies there. And we had a lot of staff who were dismissed as a result of not getting the COVID vaccine, etc. So there was that element to it. It's also an incredibly stressful job. Do we need to go to India to entice people to work in it? Or should we just sell it better to people who are already here?
Well, I think we probably need a mixture of both on this, Patrick. You're right. So we saw about 40,000 care workers lose their jobs in the pandemic because of the vaccine mandate that they had to have the vaccine to continue in the sector. But that's still only a dent in terms of these 165,000 vacancies. And what you've got to remember as well is that the problem with the social care vacancies is having an impact on the NHS as well, because many beds, you've got patients in beds, the figures over the winter have been running about 13,000 patients fit to leave hospital, but a lack of those staff in the community, in the care kind of area, means they can't be discharged. So the ambulances turn up, they can't then go out and where they've got an emergency call because they've got a patient stuck in the hospital. So what we've got here, Patrick, we've got, an aging population across the country. We know that, but it's not a new story, this is a population aging thing that you could have planned this 10, 20, 30 years ago. You just look at the demographics of the population. So a lack of planning's gone in. The pay is pretty relatively low, so maybe more needs to be done there. But successive governments, Patrick, have been looking at the funding of the social care sector. and they're always kicking it down the can, because when it comes to perhaps asking more and more people to pay more into it, it's not a vote winner. So that's the big problem. They need to get more people in, and they obviously are going abroad to try and get people in.
But what I don't understand is the NHS sends people over there to India to go and sell our wonderful healthcare system. Look at the benefits that you can have from working in our NHS, whatever they say they are. And then people in India just turn on the news and they see nurses on picket lines saying, I'm going to food banks. They see that patients are queuing up in ambulances outside hospitals. They read that we've got near record levels of A&E waiting times, and everyone's saying, basically, in a nutshell, I think a lot of medical professionals are actually saying this, which is, I regret the career choice that I made and now I'm striking about it. So why should someone from India come and work over here?
Now, that's a fair point, but what some of the NHS staff are saying is more to do with the fact that they're overworked because they haven't got enough staff. Now, what you'll find if you can recruit from, say, places like India, the relative wage differences for some of those people, they may come over for a short period of time. They might not come over and live here permanently. You know, you can build up quite a lot of wages in the UK because, relatively the wages in the UK are much better than what you get in India. And I can't imagine, Patrick, as well. They're not going to be going over there showing them that people are going on strike. But that is a critical issue that you've got. I think the big thing for me, Patrick, now Jeremy Hunt is saying that the NHS is going to have a workforce plan. He was the Secretary of State for a long time. We haven't had a proper workforce plan. Why aren't we training enough nurses and doctors in this country, the places, so that we don't need to recruit from abroad?
Yes.
We're needing to recruit from abroad now because of a lack of planning of this government and the previous government before that.
I'm not personally, I couldn't give two hoots about the nationality of an individual who wants to try to make my health better or my grandma's health better or whatever. But my concern is that it points to a wider problem, which is that we clearly aren't being able to get people who are already living here to want to work in our NHS. And I was having a chat with some colleagues about this earlier on, actually, and they were saying, I said, the NHS isn't doing a lot of great PR because even the managers in the NHS are saying that it's absolutely knackered, aren't they? But then the argument would be, well, it's not the job of NHS staff to make it seem appealing. But if one of your big problems working in the NHS is that you're telling us that you can't get enough staff and you haven't got enough staff, well, you're also, with your placards, telling people that you shouldn't work in this organisation because it will essentially ruin your life and leave you in poverty, I suppose. But there you go. Thank you very, very much. Great to have you on the show, as always. That is Jamie Jenkins, independent statistician and former head of health analysis at the ONS, just reacting initially to the fact that we've got, yes, again, massive waiting times in A&E, half of people waiting more than 4 hours, some people waiting 10 hours. We're also, of course, now having to go to India to recruit. But moving